Welcome to the Latin MedTech Leaders Podcast, a conversation with leaders who have succeeded or plan to succeed in Latin America. Please subscribe on your favorite podcasting platform, Apple Podcasts, Spotify, Google Podcasts, Amazon Music, etc. Today, our guest is Luis Santiago. Luis is PEGASI's CEO and CTO. Luis was recognized in 2016 as one of the young leaders of the Americas by the American State Department, and in 2020 as one of the 35 innovators under 35 in Latin America by the MIT Technology Review magazine. He has participated in dozens of international forums and events pointing out the importance of healthcare digitalization in Latin America. So, Luis, it's great to have you here today. Welcome to the show.
Thank you very much, Julio. It's great to be here and share this space that many leaders in the area have shared before. So it's a privilege and honor.
Awesome. Thank you for that. I appreciate it. So, Luis, tell us about your journey. How is it that you got to where you are?
Well, thank you. We in Pegasi have a background before working in the healthcare IT area. We had a company in Venezuela. We closed that company during 2017, of course, due to the situation that we have in the country. At the time of closing, we had around 8,000 users that we had digitally transformed using EHRs and our ERP software. And we were managing around 2.5 million electronic medical records in the country. So we were in contact during 2016 and 17 with many facilitators and mentors that said that it would be a great idea to extend what we were doing for Venezuela to the rest of the region. So afterwards, in 2019, we got into Startup Chile, which is a program that's conducted by the Chilean government. And we got some grant funding and we founded Pegasi here in Chile, then it's extended to the US. And we are now covering 5 countries in Latin America with the services that we provide.
Beautiful. Wow, that's quite impressive.
Thank you.
I wasn't sure about the Startup Chile part of your story. I didn't know about it. I don't remember that part of it. I mean, that's quite a program that Chile has, is an example in Latin America, right?
Exactly. And it's starting to be promoted to other countries. Actually, Startup Chile is starting to be a success case in many countries in Latin America. We have the knowledge of certain programs in Colombia that are doing exactly the same. We have
Yeah,
one in Puerto Rico that's called Parallel 18. The previous director was a director for Startup Chile as well.
I read the news.
So
Yeah.
exactly, and it's a program that these are programs that are super essential in creating an ecosystem for startups to grow in those spaces and then start expanding from those specific countries and starting exporting to other parts of Latin America. So where we didn't see the opportunity in Venezuela because of the instability of the country, we found that niche, that opportunity in Chile, and started more extending from Chile to other parts of Latin America.
Okay, very good. All right, so Luis, let's talk about trends. What do you see happening in Latin America from the political, economic, or social standpoint that is relevant to our discussion today?
Well, that's a great question. We are currently focused on oncology, so I'm starting seeing the trends in the area. Um, we recently were reviewing many of the reports from GlobalCat, starting 2018 to 2020, and we saw the number of cases, the cancer cases in Latin America increasing drastically between 2018 and now. And one of the reasons you might know that cancer and some medical circles called middle class disease.
Hmm.
Cancer happens when you don't die of other things. So
I didn't know that. I mean, that's
yeah,
fascinating. It's a middle
yeah,
class disease.
exactly. It happens, for example, when you have Africa and Latin America overcoming diseases such as smallpox or dengue, malaria. Then people grow old enough to have cancer. In the case of Africa, particularly, it's being called an epidemic right now because you have around 3.5 million cases reported every year when there were none 20 years ago, or very few many years ago. So In that sense, Latin America is starting to see a huge trend in cancer developing in the region. The first and most prevalent one is breast cancer, and the second one is cervical cancer. In many cases, cervical cancer specifically is caused by human papillomavirus, classes 16, 18, and other high risk papillomavirus. And of course, if you start seeing papillomavirus as something that's an STI, sexually transmitted disease, an STD, I'm sorry, then you start seeing the trend of how cancer spreads like an epidemic. So it's very interesting that when you start seeing the diseases that the people have, then you start seeing that these diseases are related to overcoming extreme poverty in the region and people increasing their lifespan. So you start seeing diseases that have been prevalent in the developed world, and they're starting to show up in the developing world. And we are prepared to deal with malaria. We are prepared to deal with dengue. We are prepared to deal with, I don't know, smallpox, but we are not prepared to deal with cancer. So there's a huge trend in the developing world to start preparing for these quote middle class diseases unquote. Um, and it's interesting because these are niche that are not developing medicine in the region. So there's a huge need for technology. There's a huge need for awareness, and there's a huge need for education of people in order to avoid developing these diseases.
And screening, I would say too, right?
Yeah,
I mean,
yeah.
innovative technologies, as you correctly said, to screen patients, because now we have newer technologies. For example, just to give you an idea, I'm dealing with a client of ours who has probably the only device in the world that can detect the change of temperature in the
Mhm.
breast
Okay.
prior to a woman going to mammography. So you have this little device. It's a $10, $20 device that you get at the drugstore. You put it in the fridge, and you just every 3 months or so, just put it next to your breast, and then it will give you an indication of a change in temperature, so that you have an alert. You tell your doctor, and then you get sent to mammography.
Hmm.
So
Exactly.
yeah, and other
Yeah.
technologies like that, I've seen too.
No, and it's amazing. These are very, very incredible technologies. The One of the key advantages of technology is that the sooner you develop that technology and you have that technology in the market for longer lifespans, uh, then of course the technology could become cheaper, and it's something that's something that can be acquired and massified in the developing
Yes,
world, for example.
exactly,
Mhm.
exactly. All right, Luis. So let's talk about what you guys are doing with Pegasi. What problem are you guys trying to solve with the company, and what challenges are you facing in doing business in Chile and the other countries in the region?
No, that's great, and thank you for that question. Pretty much what the mission in Pegasi is reducing time for cancer diagnostic and time to treatment by half for the developing world. This problem emerges, like I said before, there are some figures. You have 19 million people with cancer in 2020, and the race between 2018 2020 comes specifically from Latin America and Africa. And we have a disadvantage when compared to the developed world, where the mean time for cancer detection and treatment start is 60 days. And in Latin America, the mean time is 120 days. So there are some researches that indicate that for every 30 days that you take to diagnose and start the treatment of a cancer patient, their ability to emerge victorious after the treatment is reduced by 6 to 13%. So, yeah, you start with a handicap when dealing with cancer in our regions. So you might have 120, 150 days before you get a certain diagnosis from that patient. So that means that for regions such as Latin America, Africa, Southern Asia, dealing with cancer is even more expensive than not never to mention the drop in quality of care and quality of life for those patients. But it's actually more expensive because when you start treating the patient is in a stage that's further ahead. When you might have found them in the developed world in stage 1 or 2, you'll find them in stage 3 or 4 here in Latin America. So what we developed is something that we saw in the region that was happening. This thing about moving cancer information from one place to the other. For example, if you have the suspicion that you have cancer, the first thing is to create a biopsy or to take a biopsy out of the tumor. And then you might take 1 day, 2 days analyzing the report, and then you have to wait for the patient to pick that report up and then take it to the physician so the physician can review it. And then this whole process takes 10 days. And then you have the biopsy report, and the physician says that he's super alarmed, and now you have to get the patient into the OR as fast as possible. And that takes another 15 days. So in the end, between your suspicion that the patient might have cancer and the moment when the patient is having the first treatment, 150 days went by. So what we created is PEGASI, an oncology information system that allows you to have everything that is connected to the patient's cancer suspicion in the same platform, and which readily first allows you the access to the information. Secondly, gives you all the alerts and warnings that, for example, a result is ready or a patient needs due treatment at a certain point. And third, allows you to create statistics out of all the information that you have condensed. So so the idea is to create this oncology information system that first allows you to control what's happening in the oncology institution, and second, and most importantly, is to connect all the dots. Then you have all the information that you need to make a decision about the patient. So we started working in the first area that we touched was suspicion. We started working with screening protocols. The first one we launched in July 2020, in July 2021, sorry, in Ecuador, in Cuenca. We screened around 3,000 women for human papillomavirus, found 192 infections, reported those infections immediately to the physician and the patient, and we are now conducting a research to see how many patients got an appointment with those physicians to follow up on the infection that was found. This is high risk human papillomavirus. Those patients are at risk of 70% probabilities of developing cervical cancer. Um, we are also extending that protocol to tuberculosis. As you know, TB here in Latin America is a precursor of lung cancer. Specifically in Chile, it's a very, very big problem due to contamination. And then afterwards, in the diagnosis and treatment phase, we created a platform that's called Tumor Board, virtual tumor board, which allows physicians to remotely connect to discuss a patient's case, have all these assets in line. For example, you have your mammographies or your imagenology reports, your laboratory reports, your anatomical pathology reports. If you have molecular screening of the patient, you have that available as well. So when you have that discussion, you have all the assets that you need. You create a treatment case or a treatment plan, and the platform administers the treatment plan and gives you warnings when this patient is supposed to have a chemotherapy or what is the expected date of the surgery for the patient. So it allows you to synchronize all the resources that you need to give attention to the patient. So, in short, pretty much what we do is we collect all of that information and create a single pipeline to join the patient and their care team in all of the patient's journey throughout cancer. Hopefully, joining them also in researching how what results did they have from their treatment and how that treatment will benefit a patient with the exact same type of cancer. So in the end, is connecting enough information from a region that has 70% of that information in paper in order to create artificial intelligence that allows you to predict and prescribe the type of treatment for our patient. a singular patient. Mhm.
And who pays for this platform? Who's your
Yeah,
client?
that's very interesting. We have a different client. We have a client, and then we have an end user. Um,
Exactly. Yeah, I imagine that.
mhm.
Yeah.
Yeah. Currently, we most of our customers are pharma companies that are interested in conducting real world data, real world evidence research. Our biggest customer is Roche Laboratories right now. We work
Okay.
with them in Ecuador, Peru, and Chile.
Okay.
And then what we do with them is we created an R&D platform that allows, for example, a physician to interact with the patient, store that information, then they send a consent form using the platform that is digitally signed by the patient and allows their information to be used in clinical research. This is a completely automated process, and it gives the pharma a hassle-free way to obtain high-quality data to perform their
Absolutely.
research.
Absolutely.
Mhm,
Yeah. So the
mhm.
for the client, I'm sorry, for the end user, well, I take that back. So the platform is free or is easily accessible to a hospital, easily accessible to a patient, so that they can more freely enter the data because they are really the source of data, and then you sell that data to the pharmaceutical companies or whoever
Yeah, we
industry.
sell
Yeah.
exactly. We sell aggregated, anonymized analytics of that
Oh,
information.
okay. Okay.
Yeah, we never sell the source
Of course.
information. We
Yeah.
actually don't.
Yeah.
We don't have access to it.
Okay.
Whenever
Yeah. Makes
we
sense.
enter a record in the platform, it creates it's encrypted. And
Okay.
there are two keys that can unencrypt the information. The first one is from the physician, and the other one is from the patient
Okay.
themselves.
Okay.
So we don't have anything that can identify a person.
Okay.
We
Okay.
create our protocols using aggregated anonymized information, and that is the information that we use, for example, to train artificial intelligence. Well, we have an alliance with a company in Spain that's called Yakan. With that company, we are training artificial intelligence algorithms to predict the best course of treatment for breast cancer. And there are many other things that you can do. For example, if you introduce a new medication or a new chemotherapy treatment for certain types of cancer, you can validate the results in actual patients. Um,
Wow. Beautiful.
and that's the idea of having clinical information as a source of truth, and giving physicians also interfaces that allow them to create high quality clinical data instead of just writing things down in unstructured, unprocessable formats.
Yeah, but what's the experience of the physician or the patient with the platform? Because from the standpoint of a hospital or physician, don't they find
Mhm.
this redundant to have to enter information in a electronic medical record platform and then in your platform? I guess you're separate. How does it
That's
work?
a bit
How's
of
the
a pain.
adoption?
The platform works as an EMR, an EHR. We
Okay.
have like yeah, we were actually discussing this with one of the mentors this morning. They say you don't evade. There's no way you can evade doing like EHR, ERP, software development. I said no because most of the clinics in Latin America are still on paper. There's a study from the ITU, the International Telecommunications Union, that says that Latin America has like 73% of their clinical information still on paper. So, uh, yeah,
Wow.
in
Yeah.
that
We're
case,
far
if you want
behind.
to
Yeah.
install, yeah, a beautiful tumor board that will allow you to discuss twice as much cases, twice as many cases, I'm sorry, during the week, then you start seeing that for the tumor board to work, you actually have to have digitized assets. So then you have to provide those physicians with some sort of tool to actually digitize the information. And then you have to install your HIS software. And then we started like working from the HIS, which is the base, and then we started adding like these cherries on top, like for example, the tumor board, the screening platform. But you cannot have a screening platform or a tumor board if you don't have an EHR. Uh, so we have like two flavors. It depends on the institution. If they have a HIS, we create the interfaces with their HIS to recover valid information to go into the tumor board. If you don't have a HIS, don't worry, we have you covered. And then we create an ecosystem for information to move in the clinic in a digital format.
Okay. So right now, today is cancer. Are you looking?
Mhm.
Does your roadmap include other indications or other therapeutic areas?
Yeah, we currently are seeing that the space of chronic diseases in Latin America and Africa as well is the least vacated, the least inhabited. I'm sorry, by solutions, because you don't have anyone that's integrating information in all of those spaces. We have had proposals to, for example, this tuberculosis protocol, respiratory diseases that are prevalent in the region. We have had an invitation to do an Alzheimer long run test as well. Uh, so the space for chronic diseases is interesting, but the fact is that oncology is a very large niche in itself, and we see a huge impact opportunity in the
Sure.
oncology protocols. Mhm.
Excellent. Very good. Congratulations. It looks like
Thank you.
a promising technology or platform. And what
Thank you.
countries are you currently in right now in Latin America?
We are operating in Chile. Chile is our headquarters. We're working in Peru, Ecuador, Venezuela, Dominican Republic. We have uh, like 3 or 4 customers in Colombia.
Oh, really?
Looking forward to
Mhm.
expanding faster in
Sure.
Colombia. And we recently had an interview with a primary care center in Honduras. They want
Okay.
to start using the platform. So probably going to have a couple of customers in Honduras.
Nice.
And
Yeah.
then we are negotiating with our first customer in the US, given that they have to do HIPAA validations that usually takes a bit longer. But yeah,
Okay.
trying to have like we have few customers in many countries of the region. Every country that you see through is a challenge because every country has different legislations, and then you have to make sure that you are
Yes.
not stepping in anyone's toes.
Exactly. Yeah. That's the next question that I had for you, Luis. Challenges and best practices. Can we identify some common challenges among all these countries? I mean, across the board, have you seen kind of a pattern of accessing the market? Is it the language? Every country has a different kind of dialect in Spanish, different way of
Yeah,
doing things or saying things. As you correctly said, the legislation, the regulations are a little different in every country in Latin America, and that's a
yeah,
big challenge in the region. It's so fragmented, right? So please
yeah.
speak about challenges, and if you can give us some tips or best practices, that would be ideal.
That's great. That's a great question. I think the biggest challenge, as I said, is the difference in the
Okay.
legislations between the countries and the misconception that Latin America is a block country. Like, for example, you have and like in Europe, and this is only recently, like 20 years from now, in Europe, that you have a single entity that gives you access to the whole market. So in Latin America, it doesn't work like that. Every country is a world in itself, and every country has their own patterns in terms of managing information and their legal framework. For example, in our case, one of the things that helped us penetrate countries faster is the fact that we cover a legislation in the US that's called HIPAA. It's extremely secure, one of the best legislations in the world for accounting on patient privacy. And that makes it whenever we go into a country, we have to learn like the key issues that we might find in the country's legislation, but it's usually faster and much easier to implement since we comply with this very demanding legislation. We also comply with ISO 27001, and in many countries, the spirit of the law included for patient privacy control emanates from some ISO standard, like ISO 9001. So if you comply with these international standards, it's going to be a lot easier to respond to what the country is requiring from you. I would say the other large challenge is understanding the customer in each of those countries. They have different expectations, different technological development stages, and expecting, for example, a clinician from Chile to have the same level or the same awareness about technology as a clinician in Colombia is it's very it's a severe understatement. There's probably more, at least in the private sector here in Chile, there's some more awareness for healthcare technology and healthcare information technology in particular that you may have in Colombia. Perhaps not in Bogota, but in other cities of Colombia, or what you might find in El Salvador, for example. I've been talking recently with the healthcare ministry in El Salvador, and many of the things that we are proposing to them are completely new. They didn't know that it could be done. So, and it's super interesting in terms of there's a huge amount of opportunities, but of course, your sales cycle is going to be a lot slower because there's a huge education component in that sales cycle. So you have to say to people what they can expect, what is the result that they're going to get, and above all, what is the type of revenue or the type of increase in efficiency that they will get from implementing those type of technologies, because you have to tell them the whole story. In many countries, I would guess that that encyclopedical knowledge is not necessary to be shared because people already have it. Here in Latin America, you have to start from scratch.
Interesting. All right.
Mhm.
All right.
But
So,
yeah.
Luis, yeah, go ahead.
No, no, I was going to say if you're the guy that actually tells them the story for the first time, then you are one step closer to getting the niche market specifically for you, because yeah, you are the person that knows about it, and you're going to be the point of reference.
Sure. Yeah. Yeah. All right. So, any best practices, any suggested tips or courses of action that companies can take when navigating these waters in all these countries? What would you say will be your muscles of wisdom? What would you say to somebody who's just starting to think about Latin America as a place to do business based on your challenges and what you have done to overcome them?
I would say there are three things that you have to do. First, get a close look of the market that you're entering. See if there's any local dominant driving force in the type of technology that you're trying to introduce to the market. Seeing the stage of development, that is also important. Then, when you get into the market, you have to know that Latin American markets move more on connection and less on value proposition. So, uh, get a first customer that's highly respected in that
Yeah.
society or that country.
A
Create
reference client.
exactly
Yeah.
create success cases. That's the most important thing to do. And after you create that success case, do not be shy in telling that person to introduce you to their circle who are interested in having your technology. Um, I would say there are some countries where you try to keep hoard that technology for yourself because it gives you a competitive advantage. But in Latin American countries, people are like super happy to show off how great their technology is. So that's something that you can take advantage of.
Sure, you
Like
play to their egos.
exactly, and saying like, let's share this huge success that we had with people in your circle. I'll make it look good, and and it actually works. Works
Yeah,
super well.
yeah. Great sales tool. Yeah, thank you for that
Mm,
tip. I mean, very nice. I like it.
no problem.
All right, so Luis, we're close to the end of the show. How can people get in touch with you?
You can reach us on our website, pegasi.io. You can also write me my email, luis.santiago@pegasi.io. We have everything for your oncology needs, oncology information systems that can actually help you reduce the time that you take to diagnose and treat a patient by half. Um, we are also probably going to be in some events that you might go to in the healthcare industry. So be on the lookout for us.
Excellent. You guys are active on LinkedIn, I'm sure, right?
Yeah.